Medicare mistakes cost American retirees thousands of dollars every single year, and the most expensive ones, the ones that create permanent, lifetime surcharges that never go away, happen before you even sign up for your first plan. In 2026, with Medicare Part B premiums at $202.90 per month, and the income surcharges affecting more middle-class retirees than ever before, getting this right has never been more financially critical. Today, I'm walking you through the 5 biggest Medicare mistakes that quietly destroy retirement budgets, and exactly how to avoid each one. Whether you're turning 65 soon, already enrolled but questioning your choices, or just trying to understand the system before it's your turn. This is information that could save you tens of thousands of dollars. Let's start with the mistake that creates the worst financial damage. Mistake number 1. Missing your initial enrollment period. Your initial enrollment period is a 7-month window. 3 months before the month you turn 65, the month of your 65th birthday, and 3 months after. During this window, you sign up for Medicare Part A, which is hospital coverage, and Part B, which covers doctor visits and outpatient care. Miss this window without being enrolled in a creditable employer health plan, and Medicare adds a permanent late enrollment penalty. For Part B, the penalty is 10% added to your monthly premium for every full 12-month period you were eligible but didn't sign up. Wait 2 years, and your Part B premium is 20% higher. Wait 3 years, and it's 30% higher. Wait 5 years, and it's 50% higher. This penalty doesn't end. It's not a one-time fine. It's added to your premium every single month for as long as you have Medicare, which is the rest of your life. On top of Part B, there's a separate Part D late enrollment penalty for prescription drug coverage. That penalty is 1% of the national base beneficiary premium, which is $38.99 in 2026, multiplied by the number of full months you went without coverage. Wait 14 months to enroll in Part D without creditable drug coverage, and you're paying a 14% surcharge on your Part D premium for the rest of your life. How do you avoid this? Sign up during your initial enrollment period. Unless you're covered by a creditable employer plan, and you'll know because it will specifically say so. Enroll on time. The Medicare website has a simple enrollment checklist. If you're still working at 65, you may have a choice between your employer's health plan and Medicare. Many people assume staying on their employer plan is simpler and therefore smarter. That assumption costs thousands. Here's the reality. Employer plans with 20 or more employees generally allow you to delay Medicare without penalty. Employer plans with fewer than 20 employees do not. Medicare becomes your primary coverage at 65 regardless of what your employer plan says. If you don't enroll, you face the lifetime penalty we just discussed. Beyond that technicality, employer coverage for someone 65 plus is often more expensive than Medicare plus a good supplement plan. Employer premiums, deductibles, and coinsurance often stack against a Medicare-based setup, where Part A is typically premium-free. Part B is $202.90, and a solid Medigap plan runs another $150 to $300. For many 65-plus workers, enrolling in Medicare and staying on employer coverage as secondary can actually save money. For others, dropping employer coverage entirely is better. The right answer depends on your specific plan, but assuming the employer is automatically better is a mistake. How do you avoid this? Request a letter from your employer's HR department confirming whether your plan is creditable coverage for Medicare purposes. Then compare your employer coverage against Medicare plus Medigap using actual dollar figures. Don't guess. Do the math. Medicare Advantage, also called Part C, is private insurance that replaces original Medicare. The marketing is aggressive. The premiums are often low, sometimes zero. Many plans include dental, vision, and hearing coverage that original Medicare doesn't cover. For healthy retirees with predictable needs, Medicare Advantage can be an excellent choice. But here's what the commercials don't tell you. Medicare Advantage plans typically use restrictive provider networks. You might have to switch doctors. Specialists often require referrals. Out-of-network care can be significantly more expensive or not covered at all. If you get seriously sick, You may face prior authorization hurdles, step therapy requirements, and denied claims that original Medicare simply wouldn't have questioned. The other catch: switching back to original Medicare later is harder than you think. Once you've been on Medicare Advantage for longer than 12 months, you can switch back, but getting a Medigap policy to cover the gaps in original Medicare may require medical underwriting in most states. If your health has declined, you might be denied coverage or charged substantially more. How do you avoid this? Don't choose Medicare Advantage based solely on the premium. Look at the provider network. Confirm your doctors are in-network. Consider your long-term health outlook, and understand that the decision at 65 about original Medicare versus Medicare Advantage is functionally harder to reverse as you age. Mistake number 4. Ignoring IRMA and the 2-year income lookback. IRMA stands for Income-Related Monthly Adjustment Amount. It's the surcharge added to your Medicare Part B and Part D premiums if your income exceeds certain thresholds. In 2026, IRMA kicks in at $109,000 in modified adjusted gross income for individuals and $218,000 for married couples filing jointly. Cross that threshold and your Part B premium jumps from $202.90 to $284.10. At higher income levels, Part B can climb as high as $689.90 per month, more than triple the standard premium. Here's the catch most people don't know. IRMA uses your tax return from 2 years ago. Your 2026 Medicare premiums are based on your 2024 income. This means retirees who do large Roth conversions, sell a business, or take big investment gains in their 60s and early 70s often get hit with IRMA surcharges they never saw coming 2 years after the fact. How do you avoid this? Plan your income carefully in the years leading up to Medicare eligibility. If you're doing Roth conversions, do them before 63 to avoid triggering IRMA at 65. If you have a one-time income event, selling a business or property, you can file Form SSA 44 with Social Security to request a new determination, but only under specific qualifying circumstances like retirement, loss of pension income, or marriage changes. The Medicare Annual Enrollment Period runs from October 15 through December 7 every year. During these 8 weeks, you can change your Medicare Advantage plan, switch to or from Medicare Advantage, and change or add Part D drug plans. Most retirees don't review their coverage. They assume their current plan will keep working. This is a costly assumption. Medicare plans change their formularies, premium structures, network providers, and benefit details every year. A plan that covered your medications perfectly in 2025 might drop them from its formulary in 2026, or move them to a higher cost tier. A single uncovered medication can cost you thousands of dollars out of pocket over the course of a year. A plan that dropped your cardiologist from its network could force a provider switch during an active treatment plan. How do you avoid this? Every October, use Medicare's Plan Finder tool at medicare.gov to compare your current coverage against other available plans. Enter your current medications. Enter your preferred providers. The tool shows you which plans best match your specific needs and what each would cost you for the coming year. This takes 20 minutes and can save you thousands. So, here's your Medicare checklist. 1. Mark your initial enrollment period on your calendar. 3 months before your 65th birthday. Don't miss it. 2. If you're still working at 65, verify with HR whether your employer plan is creditable coverage before delaying Medicare. 3. Compare original Medicare plus Medigap against Medicare Advantage based on your actual healthcare needs, not just premium cost. 4. Plan your income 2 years ahead of Medicare enrollment to avoid triggering IRMA surcharges. 5. Review your coverage during annual enrollment each October. Plans change, your needs change. The right plan last year may not be the right plan this year. Medicare is not a set-it-and-forget-it system. It requires attention, planning, and annual review. Get it right, and Medicare provides excellent coverage at a reasonable cost. Get it wrong, and the mistakes follow you for the rest of your life. And drop a comment with your biggest Medicare question. We'll address the top questions in future videos. We'll see you in the next one.